Happy Friday. WebCME wants you to start your weekend with a win. The Clinical Connection Friday feature is cellular and tissue-based products. As an educated wound care clinician, it is critical for you to stay current with products, technologies, and terminology. The products and technologies part of that statement is obvious. But terminology? Come on, Eastcoder. Really? Yes, really. And let me give you an example. Advanced modalities are used frequently in wound care clinics, especially when patients demonstrate a flattened healing trajectory and have not decreased their wound size by approximately 50% at 4 weeks. Dr. Peter Sheehan's work is commonly referenced. Dr. Sheehan noted that if at 4 weeks a wound has not responded to our wound care interventions as demonstrated by not achieving at least a 50% reduction in size of the wound, it will likely not heal. More importantly, these patients are also at great risk for infection or other complications such as amputation. And this is the point. This is when we should consider using advanced modalities. One category of advanced therapy which has a multitude of product types and has historically been called skin substitutes. The problem here is that this title, skin substitutes, is rather nonspecific, and it does not adequately describe or differentiate between these products and technologies, and thus it leads to confusion, as well as the use of other titles, such as advanced biologicals, bioengineered tissues, and human skin equivalents. To address this problem, the Alliance of Wound Care Stakeholders, under the direction of Marcia Nussgart, the Executive Director of the Alliance, focused on creating a better name. The consensus of the numerous member professional organizations that belong to the Alliance was to use the term cellular or tissue-based products, or what they coined CTPs. The term CTP is much more accurate and a much better descriptor of this class of products and technologies. So, why is this important for you to know? Well, the term CTP is beginning to make its way into LCD policy. In fact, Novitas just released a new LCD, L27549, application of bioengineered skin substitutes to lower extremity chronic non-healing wounds. And while the old term skin substitutes is still used in this LCD, the new terminology CTP is also used. The Novitas LCD will likely set the stage for the use of the term CTP in current procedural terminology and coding manuals. And once this happens, you will not only need to know this term, you will have to use it. If you want to get paid, that is. WIN applauds the Alliance of Wound Care Stakeholders for its excellent work in this and many other areas related to wound care. And if you want to know more about the Alliance, check out woundcarestakeholders.org. Well, that's this week's WIN. We hope this clinical correlation will enhance your wound care practice. Be sure to send us your questions and follow us on Facebook, Twitter, or LinkedIn. Enjoy a safe and relaxing weekend.